want to welcome everybody to Rotary. It's a good day, a great day to be a Rotarian, again, to borrow from Blanche. And I was looking over the group, and I don't see any guests, so we can skip over that. I do have one announcement. It is just a calendar item right now, but there will be a joint Zoom meeting with the Rotary Club of Harlem and the Rotary Club of Minneapolis, which will be on Tuesday, August 18, and that'll be at 6 o'clock Central Time. We will have more details to follow. I think they're still kind of working on what the program will be exactly, so we'll give you more details. But if you want to get that on your calendar, please do, and we'll get more details to you. At this time, Steve Knoll's going to give us a Rotary Minute and give us a little bit of information about Rotary Fellowships.
Okay. So this is our little Rotary Minute about Rotary Fellowships. Rotary Fellowships are groups of Rotarians, Rotarian spouses, and Rotaractors who join together to share a common interest in a worthwhile recreational or sports activity, or to further their vocational development through acquaintance with others of the same profession, make new friends around the world, explore new opportunities for service, and just have fun and enhance their experience in Rotary. Sorry, I keep looking up. I've got to admit people as the host. So some Rotary Fellowship examples are tennis, scuba diving, flying, canoeing. Each fellowship is operated independently of Rotary International with its own rules, dues, and its administrative structure. Membership is open to Rotarians, spouses, and Rotaractors. Fellowships must be international in nature with active members in at least 3 countries. So if you're interested in joining a Rotary Fellowship, go to www.rotary.org/fellowships, and you'll find more information about them. That's our Rotary Minute.
Thank you very much. I'd encourage you to do that, vocational interest or whatever, and it's a good way to stay engaged with Rotary. I'm going to kick it back to Steve because now he's going to introduce our speaker today.
Okay, are we going to say the Pledge of Allegiance, Mr. President?
You're right. I skipped over that. Sorry about that, and I'll get myself unmuted. We'll go ahead and do the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you for catching that, Steve, and now it goes back to Steve.
Okay, so if everyone but our speaker would mute themselves. Steve Anderson is the Chief Executive Officer for the University of Kansas Health System, St. Francis campus. Steve has more than 25 years of healthcare leadership experience. He was named CEO of the University of Kansas Health System, St. Francis campus in July of 2018. His passion is providing the best possible patient and family experience. Prior to joining the University of Kansas Health System, St. Francis campus, he served as president and CEO of Jordan Valley Health System in Utah. Under his leadership, this 3-hospital system achieved several awards for quality, including being named among the top 100 hospitals in the country for women's, orthopedics, and emergency services. He successfully opened and expanded several services, including a cancer center, pediatric unit, urgent care center, bariatric surgery program, and an orthopedic surgery unit. Steve also served as the COO of Park City Medical Center and was an administrator at Heber Valley Medical Center in Utah. He also worked in executive and leadership roles for nearly 20 years at HCA hospitals in several states. He earned his master's in health administration from Virginia Commonwealth University in Richmond and a bachelor's degree from Brigham Young University in Provo. He and his wife Diane reside in Topeka. Please, everyone, let's welcome Steve Anderson.
Well, thank you for that introduction. You mentioned I arrived here 2 years ago. It's hard to believe it's already been 2 years. that I've been in Topeka. It's been a wonderful 2 years, even despite the COVID pandemic. I'm just thrilled every day to get up and come into the hospital and see what we can get done that day to improve healthcare for the citizens here in Topeka and the surrounding communities. So it's been my pleasure, and really having a great experience here. So thank you for having me today. I've been to many Rotary meetings in my career as a guest. Haven't had the time yet to join. Maybe I'll get to that at some point. But they're keeping me pretty busy here, that's for sure. But I'm happy to share with you some things and updates about the hospital. I don't know that I want to bore you, so I will keep it informative but fairly brief, just in case there are questions that you really want to, things you want to know about. But I thought it might be helpful to start things off with the era that we're in right now with this COVID-19 virus. It's certainly changed our lives, as employees of the hospital as well. The crazy thing is when things really began to heat up in early March, we had opened our command center on the 9th of March, and the world is changing around us every day, and we're getting directives from our leaders. We're a joint venture hospital with the University of Kansas Health System as well as Ardent Health Services, and we had plenty of support to do the right things and to have the right supplies and to work through this. But certainly processes changed dramatically, and we've been at that ever since. Nothing has changed for us since that day on March 9th when the world changed. And we're proud of what we've done here with both our COVID patients and non-COVID patients, and we just I want to give you an update on some of the facts and figures of what we experienced here. First of all, a lot of people across the country thought this was a real busy time with patient care with their hospitals, and certainly in areas and hotspots that erupted early on in New York and New Jersey, that was the case. Hospitals were absolutely overflowing with patients. But frankly, in most parts of the country, that was not the case. And in fact, here, by the middle or end of March, our hospital volumes had dropped 50%. And that was because all the elective procedures had to be put off, had to be delayed. And that is a lot of what hospitals do, are elective surgeries and elective procedures of one sort or another. In addition to that, patients were leery about coming into the ER. And so where you would expect ER patients to never stop coming in because it's an emergency, right? Well, we saw our ER volumes cut in half. And that was the same phenomena that hospitals across the country also experienced. And so that was a lot to adjust to. We had to downstaff and had to, run the hospital with the number of patients that we had coming in. So that was certainly a drastic change that I don't think any hospital CEO would ever expect to have to address. So we put a lot of employees on furlough. They received their benefits that maintained. They also received, the unemployment benefits from the state and the federal CARES money, and so they were, they were on that benefit as soon as we could help them with that. But certainly, most of them have come back now. And long story short, we made it through March, April, and May, and as we got into June and were able to get back to our elective procedures, then volumes started to come back and employees started to come back to work in full force. And so, certainly I'll share with you what we've experienced. This might surprise some of you, but the average daily census of this hospital is about 100 inpatients. So that's how many are overnight patients on any given day. It's about 100. Sometimes we're up to 130, 140. Sometimes we're down to about 85 or 90. But we're usually about 100. Well, out of that, we've had a census of just 3 COVID patients at a time. A census of 3 at a time. So we haven't been overwhelmed at all by by the number of COVID patients. Now, we've had many come in who we thought might have COVID, and so there is a special unit for them to go to if they have the symptoms. And when the test results come back, then we know for sure whether they're positive or not. But we treat them as positives under investigation, and then we get the answer, and then we treat them from there. So, but on the average, we've had 3 inpatients confirmed COVID at any given time. We've had up to 8 and as little as 0. Today we have 1. And so, we certainly, have been fortunate here in this area to not be overwhelmed with COVID inpatients. Certainly community spread has taken place, and certainly it's hard to trace now where people have gotten the COVID virus because of the community spread. But, those are some of the facts and figures here. Since March 9th, we've admitted 160 COVID patients. We've had 4 deaths in that time of COVID patients. Until about 2 months ago, we had very few employees who were out isolating due to potential of COVID. Patient or employees who had symptoms and were being tested were told to stay home. We're up to about 10 to 14 employees at a time who are staying at home because they have symptoms. And we've had a number of those test positive. I believe it's about a dozen that have tested positive. None of the employees have tested positive as a result of any known workplace exposure. And so we're proud of that. We feel like this is a hospital, whether it's this hospital or Stormont Vale, are probably the safest places to be in town right now. And that's because of everything we're doing to keep patients and every employee safe. As you walk in, your temperature is taken. A mask is put on you. A questionnaire is reviewed. If you pass the questionnaire, you can come in. We have very limited visitor support numbers right now. If you have a loved one who's an inpatient, we right now allow 1 support person throughout that hospitalization. So we're just trying to keep the number of different people coming to the hospital at a minimum. We have extensive PPE. We are always washing our hands. We have all the services being disinfected multiple times throughout the day. We are distancing chairs, distancing where people are working and caring. And so rooms are all private. So we've done everything that we can to keep people distanced, to have the right air filtration systems in place, the right PPE. And so we are a very safe environment. So, with that, again, what we experienced from a business standpoint, I guess you can say, as we got back to the electives in June, the patients were still hesitant to come in to the physician clinics, hesitant to come into the ER, and we really had to try to educate the community. You might have seen some of our marketing and educational pieces, whether it's newspaper, TV, billboard, that, we are safe, we are clean, don't put off your care. So those are the things we've had to contend with and deal with, is just to really help the community feel comfortable that it is safe to come into the hospital. You'll see a lot more of that in a new campaign we have coming up here in the next couple of weeks. So, where are we at today with our patient volumes? Well, some of the main indicators of the busyness or the success of a hospital from a financial health standpoint are volumes. So in the ER, that is the main intake point at the hospital, of course. And so right now, we're at about 80 to 83% of our pre-COVID volumes. And we've been there for about the past 2 months. We've kind of leveled off at 80 to 83% of pre-COVID volumes. So that may be the new norm. People might be electively putting off care or just not using the ER. We'll see what happens going forward, but that's a national number. There are some ERs in some parts of the country that are well below that. But we're at about the 80 to 83% of pre-COVID volumes. Surgeries, right now, we're even with last year, so there's been a lot of catch-up in June and a lot of catching up in July with elective cases from talking to our surgeons now, the volumes of patients coming in, they're not catching up. This is the norm. And so surgeries are pretty much on par right now with prior year. So that gives you an idea. Just in the clinics that we own and operate are also at about 80 to 82% of pre-COVID volumes. So interesting that that's not a little bit higher, but again, I think patients are still hesitant to come in unless they're really, really sick. One phenomena that's unfortunate, but it is true that hospitals across the country have seen, and we're no different here, is that the patients who do come into the ER are often far more sick than in the past. And so they put off care to the point where they're just a lot more sick. And so our admission rate through the ER is up over the prior year. So those that come into the ER that get admitted, that number is up about 40 to 50% higher than the prior year. Where we used to admit about 14, 15% of our ER patients, now we're closer to 20% on many days. So don't put off your care. If you're sick, you need to see your physician. There's no reason to put off that care. So we've talked about all the different precautions we've taken. One thing that has been a nice factor is telemedicine. Telemedicine is a great way for a patient to see their physician if they don't feel comfortable coming in or if they don't have transportation. So we're certainly going to continue to encourage telemedicine visits and are happy to do so. So if I move away from COVID for a moment and move on to the other happenings in the hospital, it's only been 2.5 years since this new joint venture has come together to save the hospital and to move it forward. And I'm pleased to say that the relationship is just absolutely wonderful with the University of Kansas Health System and Ardent Health Services. Ardent Health Services operates 30 hospitals across the country. Many of them are in joint venture relationships like this one here in Topeka. And it's just great to have both the support of both entities working together to further health care in the area here. So with that, we have a lot happening that I'm happy to report on. Our cancer center is about to receive a large infusion of new technology. We have a new linear accelerator, which is being made for us right now at the vendor's factory, and that is a huge investment. That is the radiation oncology equipment that kills cancer cells. And so that new technology is due to arrive here in December. The renovations for that space have begun, and that will again arrive in December. An associated piece of equipment that is very useful in a cancer center is a PET CT scanner. So we're replacing our PET CT scanner with new technology as well. So all told, those two pieces of equipment are an investment of $5.5 million. And so we're really dedicated to increasing the technology in oncology care and are really proud of what we're able to do here. Working with KU has been magnificent. They're one of the best cancer centers in the country in Kansas City with the National Cancer Designation. And so we are working very closely to continue to improve cancer care here in Topeka with their physicians, and their physicians are our physicians. We're sharing, we're together. We have several physicians from Kansas City who come out here every week that are here full-time or sometimes on a part-time basis. Physician recruitment is an opportunity and challenge for every hospital across the country. There are shortages in many specialties, particularly primary care, and so we're very, very focused. We have a full-time recruiter on site here, and we have several that are working for us across the country, identifying candidates for us. And so on any given week, we're bringing to Topeka now 2 to 3 candidates who are getting a tour of the community, who are at the hospital meeting physicians and practice partners and hospital administration and others who they'd be working with. And so we just, we appreciate all that Go Topeka has done and all the economic development efforts that really help us to sell Topeka to the audience who comes in to interview. So those are, a couple, key highlights of things that we're doing. In the past year, we've recruited quite a few physicians. We have spine surgeons here now, neurospine surgeons, neurosurgeons who specialize in spine here at the hospital. They arrived 1 year ago. We have a new orthopedic surgeon who came last summer as well. And we're continuing to recruit in really most every specialty that the hospital has. We have a new urologist who just arrived and looking for another to join us next summer. We have a new medical oncologist who's just signed a contract to join us next summer as well. So we are we have a new general surgeon arriving here in a couple of weeks. And so there's just an awful lot going on to really help meet the needs of the community here. And, on top of that, from a Rotary, business standpoint, we're quite a large employer here. I think we're the number 5 employer here as far as number of employees goes, and we have a payroll exceeding $100 million per year. So we do really contribute quite a bit to the economy in Topeka and the surrounding area. And so with all the new positions that we're recruiting, additional managers as well, we really strongly prefer that they live in Topeka. We encourage that. And, with that, people are buying homes, buying cars, buying furniture, buying things here, buying services that otherwise, may not be consumed. So, we're really focused on the community as well. So, with that, I would love to go on and on and on with everything that we are doing here. I love this hospital. I'm proud of it. I'm proud of the employees. We have very, very low turnover here. We have employees that have been here, many of them, for 20, 30, 40 plus years, and they love the culture here, and we're going to maintain that culture and continue to attract, new talent and retain our existing talent as well. So we're just very focused on things, and things are going very well, actually, at the hospital. So with that, like I said, I could talk all day long about different things happening here, but want to just pause and just give some time for some questions of things I might not have covered that you're curious about. I'm happy to talk more.
Hi, I'm Joni Underwood, and I'm going to go back to COVID. And does your organization do testing? And if so, how long does it take to get results? And what has been your experience regarding the importance of testing and preventing COVID?
Right, testing and preventing COVID, 2 key things. Testing is critical, right? Because if you don't know you have it, you just, people that have the symptoms may not be as disciplined as they really ought to isolate, right? If you have the symptoms, you should isolate right away. That is my advice to everybody. Well, there's a lot more advice that precedes that. Number one, when this pandemic began, I don't know that any of us knew the length of time it would go on and what the spread would be, right? So we all remember early March where everybody was staying home. Well, we couldn't stay home, those that worked at the hospital. So we were at work every day, day and night, working harder than we've ever worked before with all the adjustments that were necessary. And so, but one commitment that we made and that my leadership team made, and that we can't impact what our employees do outside of work, right? We can't tell them not to go to the store or tell them to do this or do that. They have their agency to do what they want. But frankly, they've cooperated and done a great job by eliminating unnecessary public contact. Going to the grocery store versus getting grocery pickup, or, avoiding restaurants if they don't feel like it's a safe place to be, as an example. Whatever the case might be, I think being disciplined to keep your circle of contact at a minimum is critical to get through this pandemic. And if you do need to go into public, to wear a mask, of course, that's required, but many times it hasn't been. But to wear that mask and to still keep that distance, even with wearing a mask, I think that's absolutely critical. As far as testing goes, testing has been something that no one was prepared for. How could they be? No one knew this would happen, and the resources have been enormous in responding to the task. So, what we've experienced early on in the pandemic We had patients in here that were here for 4 days before they even knew whether or not they had the virus. And that was not just here, that was across the country, that the length of time it took to get tests back was 4, sometimes even 5 days. So we treated the patient, we treated all their symptoms, we had them in a special unit, we still do, but the unit was pretty big. And we had, 20, 25 patients at a time that were here that, and most of them did not have COVID, but we had to treat them as if they did. And it took a long time to get those results back. However, during that time, when I say 4 days, that was more the exception than the norm. We were able to access KU in Kansas City, the hospital there, and the laboratory there, for testing. And that was a 48-hour turnaround time, sometimes as little as 24 hours. And so we were very fortunate we had that access with the joint venture with KU, that we had access to their testing. Other national brands you've heard of before, LabCorp, for instance, that's been across the board. For the most part, they've been at 2 days. They did spike up to about 4 or 5 days turnaround time. They opened up a new location in Overland Park and about a month ago, and they were right back down to 2 days to get the test results. Now, those patients who come in for elective surgery, or those of our employees who have symptoms, we do have limited in-house testing, but there aren't enough reagents available in the marketplace to do unlimited testing. So for our employees who we really need to work, we really need to know, if they have symptoms and whether they have the virus or not, we have reserved a lot of the in-house testing for them, as well as for those who we've gained enough supplies recently that we're now testing in-house the patients who come through the ER with symptoms. We're able to test them in-house, so within 12 hours we know whether or not they have COVID. So that has helped tremendously. And so, I think going forward, the more, reagents that are available to conduct these tests and get the results, the better off, we obviously are, because we know sooner than later if someone has the virus. So it's been across the board. Again, in summary, testing has been as quick as, half a day and as long as 5 days at different parts of this pandemic. Thank you all for your support and what you do both personally and professionally to limit the spread. Wearing masks is critical, and trying to reduce the number of different groups that you're in is also important. So great questions.
Any other questions? And be sure you unmute if you do. I am not hearing any additional questions. Or Larry unmuted.
Yeah, just a general question, Steve. We hear in the news so many more cases in metropolitan urban areas and so forth. And what is it that we're doing right here in Topeka that makes us appear to be better off in that regard than places like Kansas City and Wichita?
Yeah, well, I think we're, first of all, we're very fortunate to be here, aren't we? When you look at the rest of the country, clearly we're more spread out here, right? And I think that makes a big difference. We don't have the degree of mass transportation, for better or for worse. We don't have that compared to larger cities. So, what happens in larger cities, and what we've heard in the data, is that it's a lot of bar establishments, right, that people are at where they're very, very close with masks off. And those have been little hot spots right across the country. It's been claimed that people have caught the virus in those establishments. And so clearly, the bigger cities have more of those, and people are there more, and they're going to, spread the virus more. And so any kind of location where you've got a lot of people under one roof, right up against each other within a foot or two, that virus is going to spread. So that's, I think, what our luxury here is that we're not a big city, and we don't have as many of those establishments and as many events like that where people are close to each other. So it might be a little bit more boring, I guess, right, than in a big city. But we certainly have the benefit of staying apart, and I think that's made all the difference. But I look forward to the day where I can get back into the Allen Fieldhouse and scream and yell, and we know, heaven knows, that's probably the most densely populated arena in the country. So we'll see what happens this winter. But it's going to be a long winter if they're not playing, right? And we can go watch them. But till we have that vaccine, it looks like life will stay like this for a while.
Any more questions?
Stan, it's Glenda. I have a question.
Yeah.
In reference to the number of people that you're seeing, the increase that you mentioned that you're seeing in the emergency room, and people are now coming back into the emergency room, what information do you have as it relates to race of people who are now being coming in and being treated for some of those illnesses that are social determinant illnesses that we know might have put them at risk. For example, African Americans being more impacted.
Yeah, that's a great question. I have to, yes, a really good question. I have to tell you, I don't know. I have not heard any discussion with regards to that. So I'm going to assume that it's not been a factor here, at least at this hospital, with any highly disproportionate share of any kind of race or group, catching the virus more than another. It's the virus knows no bounds. It's really such a factor of closeness, right? I mean, if you have let's talk about a home. If there's a home with multi-generations living there, then, we've seen some of the viruses come from those settings, right? Without regard to race or anything. It's just a matter of closeness. And so, I don't have any specific data on that. I'm sure there will be a lot of published data on that coming forward. What we have seen is a shift in demographics in the last month to maybe month and a half now, is a younger population coming into the ER. They have the virus, but they're just not as sick, as the elderly patients are. And the number of admissions for those under 60, which I'm going to say now is very young, being in the 50s, that number has increased quite a bit this summer. But they're not as sick, they're not on ventilators, and they get discharged more quickly.
Thank you.
Sure, good question. Anything else?
Last chance. Do we have any more questions? Well, I want to thank you, Mr. Anderson. Very good report. I and I'm sure a lot of other people were very relieved when the University of Kansas and Arden stepped in and kept the hospital going. And I think it's been a success story, and it's been great for the community. So thank you for that.
Well, thank you. You're exactly right about that, and we appreciate the community support as well.
Yeah. Just one more announcement. Want to go over next week's program. One of our own club members, Mike Worswick, will be speaking in his topic, and this has piqued my interest because I'm not sure which election he's talking about, but the title of it is Theft of an Election in Kansas. So I don't know if that's recent history or early history. Probably early, but I don't know that for a fact. But anyway, that'll be our topic next week. And as always, I want to finish up our meeting with the 4+1+1 test, or four-way test. And we'll say that together if you can unmute. The things we think, say, or do is that the truth is fair to all concerned, will build goodwill, better friendship,
Will it be beneficial to
all concerned? Will it be fun?
And
will it be
is it kind? All right.
We got Joni's number 6 in there. So in any event, thank you for a good meeting. Thank you again, Mr. Anderson. And hope to see everybody next Thursday. Stay safe and wear your mask.